talk about Bermuda's vaccine, COVID-19 vaccine, and learn how it works. If you're watching on government's Facebook page, I encourage you to post your questions and comments below, and we'll ask our young panelists to answer your questions. Wendy Ingham is the sign language interpreter for the deaf and hard of hearing, who has also joined us tonight. Good evening, everybody, and welcome. Welcome to my two panelists. Now, I'm just meeting you both for the first time, and I would like for you to tell us who you are, tell us a little bit about your background, tell us about your medical education and background, but most importantly, tell us who you are. Tell us who your people in Bermuda are. Yvonne, Michelle, let's start with you.
Yes, thank you. Good evening to everyone. As mentioned, my name is Dr. Michelle Spencer. I am the daughter of William Aaron McDonald Spencer and Marcia Spencer. I have two siblings, Monica Kelly. She was recently called to the bar. People, when I was at home, often told me congratulations for that. I just said thank you, but that wasn't me. That's my sister. And my brother is Aaron Spencer, who's been around the island for being a saxophonist, and he plays football very well. He's on the Crossroads team and has represented Bermuda nationally. For me, I did most of my training, all my high school and elementary was at Bermuda Institute. I'm a proud graduate of the class of 2005. I left Bermuda Institute and I went to Oakwood University, where I studied biology. I knew from then that I wanted to be a doctor, so I entered in as pre-med in preparation to go to medical school. I knew that Oakwood University had an excellent pre-med program that had really good outcomes for getting people to their goals of going to medical school. I was able to go straight through. They allowed us to get our on track where we did in our sophomore year, we did our MCAT, which is a little bit advanced from some other places, and we were on track to go. I went on to Loma Linda University for medical school, and I graduated in 2013. And I made the decision to become a pediatrician. So when you go to medical school, you know you want to be a doctor, but there's a world of options. And I chose to become a pediatrician. I got exposure in baby intensive care, and I fell in love with it. So I made a decision to not just be a pediatrician, but to be a baby intensive care doctor. I had one of my cousins was actually born very premature, and I saw how well the care that they provided for her in the intensive care, and I'm able to do that for babies today. So it's awesome. I love what I do. One of the things I'm most passionate about is trying to help people learn how to navigate healthcare. So I'm very happy for this opportunity to be able to assist us in understanding this important vaccine that will assist us to get through this current pandemic that we're in. Nobody asked for this pandemic to be here, but it's here. So we have to figure out how we're going to navigate it. And this vaccine is one of the ways that we're going to be able to do that.
Excellent, thank you. Great introduction. Dr. Williams.
Good evening, everyone. Good evening, Bermuda. My name is Shama Williams. I am number 6 of 8 sons born to my parents, Carlton and Brunella Williams. I grew up on Friswell's Hill, went to Bermuda Institute and graduated in 2003. I was probably in 5th grade or 6th grade that I decided I wanted to be a doctor, and 11th grade when I decided I wanted to be a cardiologist after doing anatomy and physiology, and then having the opportunity to actually work at Bermuda Hospital in the cardiology department. So after graduating from Bermuda Institute, I also attended Oakwood University, formerly Oakwood College. While there, I double majored in mathematics and biology, graduating summa cum laude in 4 years. And then I went on to Loma Linda University Medical School, where I pursued my Doctor of Medicine degree. Because I wanted to do cardiology, the way to cardiology is through a career in internal medicine. So I went on to the University of Alabama in Birmingham Hospital, where I did my internal medicine residency, and then have returned to Loma Linda University for my cardiovascular disease fellowship. I completed my fellowship in 2017. I'm currently faculty at Loma Linda University School of Medicine, where I teach students and train interns and residents in how to become effective and excellent doctors. I also work at the county hospital in San Bernardino, known as Arrowhead Regional Medical Center. And there I practice as one of the clinical directors for the cardiology clinic.
Excellent. Thank you. Thank you both for taking the time to join me today for our vaccine discussion. And so I want to start, Michelle, tell us about your experience. When you think back a year ago, when we think about a year ago, last January, we may have heard a little bit of rumbling that there was something out there. We now know it was COVID-19. And so what is the difference between a year ago and practicing medicine and maybe what you experienced yesterday or even earlier on this week? What is the difference? What are you seeing?
Huge difference. So I can tell you in January of 2020, I did not have any kind of virus, definitely didn't have a pandemic on my mind. I was actually at a conference in California with a large group of physicians all together in a room, just learning some of the latest technologies that were coming out. We didn't have any focus on anything, and we traveled back, and I was practicing medicine as usual until about March, when we realized that things were changing. Actually, one of the tests that I was supposed to take was canceled. So for us, we don't have tests that are canceled in medicine. So when that happened, we knew, there's something serious going on. Initially, when it first started, the biggest things for us was making a change to make sure that we could protect ourselves and protect our patients. And it was very different from anything we had done before. And I think a lot of the efforts initially were to try to get us with enough of the protective equipment so that we can continue to provide the care that was necessary. But I think people didn't even realize that we were being asked to use the protective equipment how we had never used it before. So we were being asked to reuse some of it, which was not normal, but we were responding to the crisis that the world was seeing. For us in the neonatal ICU, so like I mentioned, I take care of babies that are very, very sick or babies that are very premature. And so for our care, we have some babies that are born to COVID positive mothers, and we have to do something that we've never usually had to do, and that's separate the babies and the moms. And so we separate the babies, one, to protect the baby. We put into a negative pressure room for about 48 hours. We get a test at 24 hours and another at 48 hours based on the recommendations from the American Academy of Pediatrics right now. And once that's cleared, we are allowed to take the baby out, but we don't reunite the mom and the baby. And for a lot of people, that's something that people would never consider, the mom and the baby being separated. But that's just another thing that COVID has done to all of us. It made us practice a lot differently from how we usually do.
Thank you. Dr. Williams?
So like Michelle, definitely a pandemic was not anywhere in our thought processing back in January or February of last year. At that time, the way that we practice medicine, specifically in cardiology, is that we would have our patients actually come in to see us inside of the hospital or to see us inside of the clinic. We would be able to put our hands on our patients, to listen to their hearts, to try and identify and treat their cardiovascular diseases. The other thing that was really important for me as a cardiologist was being able to actually look at my patient face to face and have conversations with them with regards to their clinical conditions. One of the things that the pandemic has changed is, number one, I no longer know what my patients' faces look like. Everyone is now required to wear a mask, and so we don't truly have that true person-to-person interaction that we would like to have. We can't do the same thing through video conferencing. And then there are instances where we sometimes have to communicate information now via telephone, which sometimes would be better communicated in a face-to-face sit-down conversation where you can understand body language and then proceed to answer additional questions that patients might have. In addition to that, one of the things that we have found is there are instances where people may be delaying coming into the hospital because of the fact that they have concerns related to the coronavirus and COVID-19 infection. And so rather than people coming in as soon as they experience chest pain, they may delay that and develop worsening of their heart disease or worsening of a heart attack. The same thing applies for conditions like heart failure, where people may have swelling in their legs or feet, or might experience lots and lots of shortness of breath. They may delay coming in to seek treatment because of concerns related to the COVID-19 infection. As it pertains to practice inside of the hospital, we definitely have had to take significant measures to protect ourselves and to protect our patients and to protect our community and our own homes as physicians. So we wear face masks, we wear protective gowns, we wear protective eye coverings as well when we're seeing patients who have COVID-19 infections specifically. One of the things that I recognize as a physician is that I have the ability to kind of know who has COVID-19 because we are testing for this frequently when people come into the hospital. The other thing that I see here in cardiology is the fact that the COVID-19 infection is now causing worsening of some cardiovascular diseases. So there might be people who come into the hospital with a COVID-19 infection who did not necessarily have a heart problem prior to their presentation, but after surviving COVID-19 are leaving the hospital with heart problems related to this diagnosis.
And so you mentioned protection. Have you both had the vaccine? Have you had, and if so, which vaccine have you had? Dr. Williams, let's start with you.
So I actually got the Pfizer vaccine. And so I got my first dose on December 17th, and my second dose was 21 days later, January 7th.
Okay, excellent. Dr. Spencer?
The same for me. I also got the Pfizer COVID vaccine. I got my first dose on the 18th of December and the second one 21 days later as well.
And did either of you have any reaction or any side effects once you got the vaccine? Dr. Spencer?
For me, I had very minimal side effects. I know some of my colleagues had different experience, but I just had pain at the site. That was it. So the next morning, it was just a little bit of still muscle pain. And that was the same for me after the second dose. So a lot of people were saying, well, you know, after the second dose is going to be a lot worse, but I didn't have that as my experience. Some of my colleagues did have some low-grade fevers and then a general feeling of not feeling well. So it felt a little bit sick and then headaches. And so that was some of the findings that some of my other colleagues had, but I didn't experience that myself.
Okay, Dr. Williams.
So I got my first vaccine on a Thursday. That Thursday evening, the site where I got the injection was sore. By Friday evening, I was experiencing some tiredness and fatigue. So I went to sleep early, and on awakening Saturday morning, I felt pretty good after the first dose. The second dose, similarly, I had pain at the injection site and some associated fatigue. I also experienced some headache associated with the second dose that lasted about 2 days. In general, these symptoms are symptoms that can be managed with good hydration, with medications that can be gotten over the counter like Tylenol or Advil. Those medications can frequently be used to help temper some of these symptoms. But if I consider my symptoms in comparison to the COVID-19 infection, I would choose my symptoms over COVID-19 any day.
So there's been a lot of speculation, not just in Bermuda, but around the world about the vaccine, and people are, you know, doing their research and asking questions of their medical professionals and others. What advice would you give to, and let's look at different groups. What advice would you give to your parents? If your parents said, okay, you're a medical, you're doctors now, what should we know as your folks about taking the vaccine? And then I want to hear what you tell your patients. What concerns do your patients come to you with when they ask you about taking the vaccine? Who'd like to go first?
I'll go first. I think one thing that's interesting that most people probably don't realize is that healthcare providers as well, we question things too. And when this vaccine came out, I have a very prove it to me personality. And so when this vaccine came out, I had questions just like many of you have questions, and I wanted answers. And the one nice thing is I knew that I would make sure that I found answers so I can make a good decision. I knew that I didn't want to let fear or my ignorance on the topic keep me from doing something that would be a right decision, the decision that I should make to protect myself. So what I did was I looked at the studies that have been done to date. I looked at the side effects, and then the next thing I did was speak to some of the physicians that are directly taking care of patients, infectious disease doctors who do this a lot, and people that I trusted to see what they also thought about the vaccine. So I got a evaluation of it as best I could to weigh benefits and risks. And at the end of the day, for me, I realized that the benefits significantly outweigh the risks. So the risk that we know of with the disease is that people could die. That's the ultimate risk with COVID. Unfortunately, it's our reality though, that people are dying. And although we've tried our best to risk stratify and say, you know, people that are have these certain diseases ahead of time, we know that they're higher risk. But we found that even people my age, I'm 33 years old, that are healthy are also having significant morbidities with it, and some people even dying, which is hard. So it means that we have to pay attention too. Our age group has to see what we can do to make sure we can prevent it. One of the most important things I will say for me was making sure that I don't pass the virus on to any of my family members. That was the most important thing to me. I've been working through the pandemic since January all the way through nonstop. And the most important thing to me was not to pass it on. So for my family, I would say, based on everything I've looked at for this vaccine and the way that it shows that it should prevent infection significantly. And for those who do get infection, it decreases your risk significantly from having the undesired effects of COVID. I would recommend my family to get it. And me getting the vaccine, I had my family on my mind because I wanted to make sure I could say, based on my experience, what I've known the vaccine to be, so that I can assure you that I recommend for my family members to get it.
Okay, thank you. Dr. Williams?
Like Michelle, I also had my concerns related to the COVID-19 vaccination. The climate at the time at which this vaccine was being manufactured and studied was not the best conducive climate from what we could see in terms of politics. I take some solace in the fact that these research companies and vaccination companies practice independently. I take comfort in knowing that their study information is peer reviewed, which means that people who are not directly related to these companies have looked at the data and determined the data to be sound and true. Not just that, I look at the data itself. When a vaccination states that it has about 95% efficacy, that means that 95% of the people who receive the vaccine do not get the actual COVID-19 infection. And so that is a very, very positive and very reassuring number. Not just that, out of the people who got the vaccine, who subsequently came down with COVID-19, their symptoms were not severe, so they did not develop severe COVID-19 infection. Now, as a cardiologist in my practice, while I'm not predominantly the one who is putting down a breathing tube or managing patients in the ICU, I do actually see COVID-19 patients who experience complications related to their heart problem from COVID-19. So some of these problems might include heart attacks. Some of these problems might include abnormal heart rhythms. Some of these problems include persistent fatigue and tiredness. Some of these problems also may include some conditions known as dysautonomia, where it seems like the nerves and the blood vessels don't communicate correctly. Like Michelle said, the risk associated with death from COVID-19 is probably around 2%. But we know that people who survive continue to experience long-term symptoms associated with COVID-19. And so one of the things I look at when I think about whether I should take a vaccination is what is the risk of the vaccine and how much benefit do I actually get? What can I determine to know and be true, and what is unknown? And I have to kind of make the list and weigh what's good for me and what's not so good for me. One of the things that was a challenge for me is the fact that at the time that I took the vaccine, which was back in December, we did not have a lot of long-term data related to the vaccine. And if we're honest, we can still concede we don't have as much long-term data related to the vaccine. However, we do have data related to its efficacy in the short term, and we do have data related to the long-term effects of COVID-19. And so we have to weigh those two things. And after I weighed it, I determined that the vaccine was the better decision for me. When it comes to my family and my mama, I'm like, Mama, you got to get the vaccine when it comes out. There are, like during this pandemic, there were instances where I would tell my mama, I want them just to take your car keys so you can't go anywhere, because my mama is my life, my mama is my heart. And so I want to make sure that as a Bermudian, we protect our communities, we protect our loved ones, we protect our friends. And it was important for Michelle and I to be able to have this conversation, and we're so grateful to be here because we truly do care about our community in Bermuda.
Thank you. Really, thank you for your responses. And you've touched on Bermuda, but let's look outside of Bermuda in the areas where you are physically located. And Bermuda has done a really good job in being able to manage the outbreak that we had in November, December, and our confirmed cases numbers have been steadily dropping. But what is the positivity rate in the areas in which you guys live? And just tell us where you are and what you're seeing in the hospitals where you're working. Dr. Williams.
So I currently live in Loma Linda, California. So in the state of California, the positivity rate is currently greater than 10%, I think upwards of 13% at times. What we have been seeing here in my hospital specifically is there are some limitations in terms of access to care sometimes. So when you think of a hospital that has about 450 beds, and you look through your hospital and recognize that there are more than 100 people with the exact same condition, it kind of opens up your eyes a little bit to begin to understand that this is a disease that does not care about who you are, what you do, what your name is, and who you know. This is a condition or disease that is out to find people that it can hurt and kill. Being inside of the hospital, the other concern is there are instances where there are people who need to get into the hospital who are not necessarily able to do that, or are not able to get the resources that they need. For example, if I have a critically ill patient that I need to transfer to another hospital, right now I do not have the ability to do that because a lot of the other hospitals are full dealing with the exact same problem. There were instances in the Los Angeles region where ambulances would be driving for hours trying to find a hospital to take patients to because there simply were no beds. And so for a large community such as Los Angeles, or a larger community being California, when we compare that to a small community like Bermuda, if this virus is not addressed well, and if it's not taken seriously, if we are not taking precautions to wear our masks, to practice social distancing, and to receive vaccination, it is likely to do a lot of harm if we're not careful.
Thank you. Thank you. Dr. Spencer?
Yeah, I just wanted to piggyback off what Shama said with regards to us in Bermuda taking it seriously in terms of we don't want the COVID-19 to take over the island. And I would say that our government has done an amazing job at taking this virus seriously. and making sure that we've implemented things that actually have saved lives. It really has. And it's made a difference because just like Shama said, in the US here, we've had issues where people are not able to get access to care just because of the hospitals are so full, the ICUs are so full. When we go into medicine, I can tell you 100%, we never want to be able to be in a position where we can't take care of someone who needs our help. So you can only imagine the people on the front lines who are trying to take care of these people, but aren't able to because the resources are low and the spaces are low. We don't want that to be our story in Bermuda. And the way that we do it is to be preventative. Like an ounce of prevention is worth a pound of cure. I couldn't say that more. It's really true. So I think making sure that we do everything we can, like wearing our masks, social distancing, and then adding to it where we are incorporating this vaccine will help us to overcome this pandemic and come out on the right side. For me, I live in Chattanooga, Tennessee. And for Tennessee, our positivity rate's about 12.3. Its increase looks like to about 13 in the last 7 days, but ours is pretty high as well. At our hospital, it was earlier in the pandemic where we actually had to shut things down to kind of make a little bit more space. So we stopped elective surgeries and different things like that. But now we've resumed some of that care and are still managing the patients with COVID. So.
Okay, thank you. I'm gonna just go to a few questions that have come in on Facebook. So one question is the body still able to create an immune response from the vaccine if you are on immune suppressing drugs?
So that is an excellent question. So the body is able to create an immune response, but it may not be as robust because of the immunosuppressive agents that people are on. So it is very important that before you take the vaccine, you have a very candid conversation with your physician. There are many types of immunosuppressant medications. And so it's important that you discuss specifically with your physician or healthcare provider with regards to whether or not it's the best decision for you.
Okay, thank you. Will a person test positive for COVID-19 after receiving the vaccine? Dr. Williams? Oh, sorry, Dr. Spencer. I saw you get ready to answer.
Oh, no worries. The answer for that is no. So one interesting thing about this vaccine is that it's different from a lot of the other vaccines we've done in the past. So the old vaccines would use a part of the virus, a dead version of the virus, sometimes a live version, that the body has to build a response to that. But this one actually uses a coding part that is very similar to the virus, which allows the body to make antibodies and memory T cells to that specific part of the virus. And it doesn't actually introduce the virus to your body at any time. So it's a little bit different. You won't be testing positive just because you got this vaccine.
Okay. And another question, how long does the vaccine last? I'd like to take that one.
So I'll take that question. And I think that is the question of the ages right now. How long will I have immunity after receiving the vaccine? I believe that is one of the unknowns. We just have not had enough time to know with 100% certainty how long someone will have neutralizing antibodies associated with this vaccination. And what we do know is that it's likely a couple of months at least. And the preventative course that this vaccine allows will significantly reduce your risk for development of COVID-19 in that time.
All right, let's see, what else do we have here? I'm hearing that while the vaccine is being distributed to frontline medical workers and Bermudians over a certain age, is it being offered to people who show up at the vaccination centers with them? Is this, okay, so I'll take that question. That's very specific to the vaccination center. No, there are no walk-ins at the vaccination center. You must have an appointment. So I took that one. I'm looking at the time. It's 6:29. And so what I'm going to do is just ask you, as we wrap up, any final words, any words of advice or guidance, any thoughts, any shout outs that you want to give to the people of Bermuda? Dr. Williams, you can go first.
Okay. Shout out to my brother, Orlin Williams. It's his birthday today. So happy birthday to you, Orlin. As it pertains to this challenge that we are facing as a world community and as a smaller Bermudian community, I think that skepticism is okay. It's okay to ask questions. It's okay to do research. But make sure that the information that you're receiving are coming from reputable sources. Make sure that the information that you're receiving is fact-based and not based on conjecture. It's important for me to make decisions that are based in truth and evidence and fact. And so if you're able to do that, I believe that you will come to the correct decision for you and your family. The other things that I think is important is to also consider the what ifs. And this is sometimes something that is very challenging, even when I counsel my patients. What if things don't go the way that you would like? For example, what if I develop COVID-19? How does that affect my family? How does that affect their ability to keep a house? How does that affect their ability to continue to pursue education if I have children? It's important to ask those questions as you consider your decisions as to this COVID-19 vaccination. From what we know to date, the risk associated with the COVID-19 vaccine is very low, but the likely benefit is high.
Thank you. Thank you. Dr. Spencer?
I agree with what Dr. Williams said. The biggest thing that I would pass on is don't let fear and misinformation stop you from doing something that could be the right decision for you. And not making a decision on it is a decision. And so what we want you to do is try to speak with someone that you trust, a healthcare provider that you can go to, ask all your questions, and you know that they will give you the information that's best for you. The other thing that I always tell my patients is, I know you're gonna look stuff up online. You are, everybody's gonna do it. So I usually recommend that people check out the .org websites, the .gov, and for us, the .bms to get reputable sources on the information. So don't just say, I don't want this vaccine. You gotta get some information so that you can make an educated decision. And for me, when I talk to my patients, that's the most important thing. I want them to make a decision that's educated, so filled with the information, and you've done what is best for you and your family. So that's the most important thing. While I recommend a vaccine, I would say that you would have to go and make the decision that you think is best for you and your family, and speak to a healthcare provider who can assist you in doing that. For me, some shout outs that I would give definitely to my mom and dad, Aaron and Marcia, and my sister, Monica Kelly, and James Kelly, her husband that's watching. I know my brother's watching. And I am the cousin of Wayne and Dwayne Kane, so I'm sure they're watching too. Hey, family. Hey, friends. So get the vaccine is my recommendation, but totally do what's best for you and your family.
Well, thank you both. I've really enjoyed our conversation today. I appreciated your time. I appreciated the guidance and advice that you've given to us here in Bermuda. I really wish you both well in your careers. I hope at some point you get to come home and work here in Bermuda, so that we can see you thriving and succeeding in our community. But thank you both for your time. Thank you for your guidance and expertise. And I'd like to say good night, Bermuda. And join us again next week here at 6 p.m. For more vaccine awareness. Join the conversation. Good night, everybody.
Bye.